Welcome to the International Journal of Paramedicine podcast. I'm Mick Gunderson, the editor-in-chief. And for today's podcast, I have Dr. Chelsey Torgerson joining me for a discussion of the paper she was lead author on, entitled Mental Health Symptoms, Stressors, and Coping, an exploration of first responder experiences working in rural, suburban, and urban areas. And this was written by Torgerson, Taylor, Hughes, Chapman, and Kennel. And this paper appears in IJOP issue number 11 for July-September 2025. I'd like to remind everyone that most of the manuscripts published in IJOP have an associated discussion thread on the NEMSMA email listserv, which is hosted on Google Groups at groups.google.com/G/NEMSMA. You're invited to go there to ask questions and make comments about this and other IJOP papers. We want to get you and other paramedicine professionals participating in scholarly conversations about these papers to help advance our discipline. Our editorial team will then curate the best parts of these email discussion threads so they can be published in the dialogue section of the journal, which is our version of the traditional letters to the editor section. If your question or comment is selected for the dialogues, you'll be officially cited. So please join in and make your voice heard as a paramedicine professional. Here's the interview. Welcome, Chelsey. I appreciate you joining me here to talk about your paper.
Thanks for having me.
So let's start out with you telling us a little bit about your background.
Yeah, so my name is Dr. Chelsey Torgerson, and I'm an assistant clinical professor and the clinical coordinator in the Marriage and Family Therapy program here at Lewis and Clark College in Portland, Oregon. So I teach in our program, and I'm also the faculty contact for our students who are in their clinical training portion of the program. So they're the folks who are seeing clients, and I support them and their sites. I'm originally from a rural town in Minnesota, and that's an important through line, I think, for kind of the paper that we're going to be discussing. And I'm a trained family therapist, and I'm an addictions counselor, and I see clients in a private practice here in Oregon.
Excellent. Well, tell me, if you will, a little bit about the problem or issue that you and your co-authors were trying to address with this project.
Yeah, so we know that first responders experience mental health symptoms, issues at a higher rate than the general population. And we were really curious about whether or not the mental health experiences, the types of stress, and the coping strategies were unique to folks who were providing services in rural areas, suburban areas, or urban areas.
What was it that motivated you and your team to work on this particular problem?
Yeah, so this paper and this project is really personal to me. My dad was a volunteer firefighter in the small town that I grew up in for about 25 years. And so I grew up understanding fire sirens and fire pagers and parents leaving in the middle of dinner to go and report to a car accident or a structure fire. And so like that was just the context that I grew up in. And as I grew up, it became my friends who joined the local fire departments, and they're volunteering in those capacities. And I started to think about, especially as I moved into the mental health field, like, how do these folks cope? And how do they show up in these rural areas where they grew up in? And so what really led to this project was a series of tragedies that kind of happened in before COVID, but in the area that I grew up in. And I was like, they were very tragic instances. And I was left wondering, how are these folks coping with the outcome of what just happened? And, you know, the nearest mental health providers are 30 plus miles away. And so we know that mental health care in rural areas is underserved. We know that seeking help in the first responder community can be really difficult. And so I kind of intersected all of that into, why don't we look at, are there unique stressors for folks serving in rural areas compared to larger metros where there might be a higher call volume, but maybe the folks who are first responders don't know the people that they're responding to? And what types of coping strategies are implemented, and then what types of services are available? Because I'd seen, you know, CAL FIRE has put a lot of efforts into mental health programs for first responders. And I've seen other metro areas hire behavioral health specialists to be in-house providers, and that's not always available in rural areas. And so really the emphasis for me was trying to understand the context of rural first responders in a different way.
No, that makes a lot of sense, but that that's all very qualitative. So maybe could you tell us a little bit about the methodology you used to conduct this project?
Yeah, so we created a Qualtrics survey, and the survey included basic demographics, and it also included mental health questionnaires that actually use clinical cutoff for potential diagnoses and what would meet that threshold. And then we had some other measures that were used around quality of life and stress, like stressors and things like that. And then we had some open-ended questions as well. So the survey was both qualitative and quantitative. And we had a list of first responder agencies in Oregon. And we sent emails with a link to the survey to the supervisors or the main contact at those agencies or organizations. And we had them distribute the survey to their first responder team. And participants self-selected to respond. And we gathered data across the state and were able to get a pretty large sample of rural providers, and then about the same amount of urban and suburban, if you combine the two of them together to get our whole sample.
Well, very good. So you went through all of that effort. What did you find? What were your main findings?
Yeah, so our sample was primarily, like I said, people who worked in rural areas, mostly male, mostly identified as non-Hispanic white. Most of our participants were married, and most of our participants worked in a full-time capacity. That was actually really surprising for me because of the context that I grew up in, where a lot of the rural first responders were volunteer-based. So that was an interesting finding. One of the things that we found in terms of like mental health symptoms was that depression, generalized anxiety, and PTSD were more evident in first responders in urban and suburban areas, but suicide risk was more prevalent for providers in rural areas. And so that was an interesting context to kind of really understand the mental health experiences of our participants. And then we got into the qualitative findings, which is that's where we got more of the information about the actual stressors that folks were experiencing, the different coping and access to resources. And so some interesting findings in the job stressors was that people who lived in suburban or urban areas cited a lot of larger societal issues as stressors of theirs. So things like racism and COVID, housing insecurity, those were primarily only reported by people in urban and suburban areas. And I think that it's important to contextualize when we collected data. So we collected data in the kind of right around now, but in 2021. And if anybody remembers kind of the context of 2021, we were in a like mid-COVID state, right? Vaccinations had just started rolling out to the general population. And Portland specifically had a pretty big 2020 with Black Lives Matter protesting and a lot of news kind of really focusing in on what was happening in the Portland metro. And so I think that when we collected data, there was just kind of lingering effects from that folks who lived in the Portland metro experienced in a very different way than the rest of Oregon. And so that was an interesting finding. Now, when it comes to job-related stressors, urban and suburban respondents more frequently mentioned issues with management as a source of stress. Whereas, all of our first responders mentioned that like tough calls were really hard, right? And calls with children, really difficult. And so urban and suburban folks also mentioned that, but it was more likely to be mentioned by urban or by rural providers. And so the type of call, those really life or death type situations, seem to impact folks in rural areas a little bit more. And then, of course, call volume. The number of calls that come into urban and suburban precincts is going to be much higher than some of those rural areas. And so that was mentioned more significantly by providers in those areas. The mental health, relational, and financial stressors from being a first responder were mentioned. There wasn't many difference across geographic location. So those seem to be stressors just across the board. And so it was really interesting to get a sense of the types of consistent stress that just is like, this is part of being a first responder. And so it's stressful for everyone, versus the geographical differences that we did find in some of the participant responses. Next, we looked at coping. And what was really interesting about the coping response is that some of our participants gave us kind of functions of the coping, like why they were using this to cope, and other people just wrote down what they were doing. And so we were able to organize our data in that way. But a lot of participants indicated utilizing various coping strategies to avoid, ignore, or distract from whatever stressor they were experiencing. And avoidant techniques were way more common in participants in urban and suburban areas. So our rural respondents were more likely to address the issue head on, whereas urban and suburban participants were more likely to avoid or use different techniques to distract, which was really interesting. And then this is, I think, also interesting, but maybe not surprising, is that the participants in urban and suburban settings were more likely to seek services, mental health services, from professionals, whereas the providers in the first responders in rural areas were way more likely to seek support from families and friends. And that could be because of an accessibility to resources or sources, but it could be something else as well. And so final finding, I think, is that there was a lot more accessibility to mental health resources and mental health in general for folks who provide services in urban and suburban areas than there are available to folks in rural areas.
Oh, wonderful. But given all of that, what impact do you anticipate or would like to see as a result of this work? What are the implications of this? Is there something that you might see that EMS organizations might be able to apply to their policies, procedures, employee assistance programs, or whatever the case may be?
Yeah. So I think that there's as somebody who, grew up in the context of having a parent that was a first responder and also being a mental health provider, I think there's a lift for both the mental health field and for first responder agencies, right? And so I think one of the things, while I know that papers aren't going to solve, it's not going to solve all of the problems all at once, but I do think that we need more therapists who are equipped to provide services in rural areas. And we need more mental health providers who understand the complexities of what being a first responder even means across all geographic locations, right? So we need to better train our mental health field to be able to meet the needs of first responders and help break some of that stigma. But we also need first responder agencies and organizations to be able to better understand the needs of their employees. Right? What do first responders need? And maybe it's not always talk therapy, right? So maybe I'm not supposed to say that as a therapist, but I do think that finding creative ways to emphasize the importance of mental wellness, and that mental health can look so many different ways, and that perhaps helping support first responders requires creativity. And that talk therapy may work for some and it may not work for others. And so finding initiatives and programs that meet those needs. And so I guess my ask for mental health providers is to, if you feel called to, partner with first responder agencies to see what are the needs and where can we fill in those gaps. And then on the first responder side, to really try and get to know your providers and see what do they need and where can we go to get those resources.
Well, very good. I appreciate all the effort that went into this paper, and certainly the efforts to try to help improve mental health, wellness, and resiliency overall within our discipline. It's something that is too often neglected, doesn't get nearly enough attention as it should. So thank you very much to you and your co-authors for doing this work. I'd like to remind those watching or listening to this to check out the full manuscript of this paper in our July-September 2025 issue. Then go to the listserv to ask questions and make comments about the paper. We also invite you to subscribe to the IJOP channel on YouTube and your favorite audio podcast platform to watch or listen to other interviews, abstract presentations, and IJOP content. So on behalf of the National EMS Management Association and the entire journal staff, thank you.